Some of the most dangerous moments in medicine make no sound at all. They build slowly, in the dark, while a person sleeps peacefully beside someone who loves them. There's no warning, no chance to call for help, no second attempt. And here's the part that catches almost every one of my patients off guard when I explain it to them in the recovery room. These moments are almost never caused by anything dramatic. They're caused by something small, something so ordinary you probably did it last night without a second thought. I've spent more than 2 decades in operating rooms repairing damaged arteries and holding failing hearts in my own 2 hands. And in all that time, I've watched the same quiet, preventable patterns show up again and again in people who had no idea what their evening habits were doing to them. Tonight, I want to walk you through 5 of those patterns, 5 ordinary habits that, without you realizing it, load the gun while you sleep. And then I'll show you how to disarm every one of them, one small evening adjustment at a time. Stay with me. What you're about to hear might be the most important few minutes you spend on your health all year. Here's something most people never learn. Your heart doesn't clock out when you fall asleep. It simply changes its mode of operation. In a well-functioning body, nighttime is when blood pressure is supposed to drop, typically 10 to 20% below daytime levels. Your heart rate slows, your arteries loosen and relax. It's a nightly reset, a form of internal maintenance your body has quietly performed your entire life. But somewhere past age 60, that system starts to lose precision. Arteries stiffen. The reflexes that regulate blood pressure become less exact. Certain protective hormonal signals that used to shield your heart overnight begin to fade, and the room for error shrinks dramatically. Think of your cardiovascular system like a business during business hours. Full staff, backup systems, room to adapt. At night, that staff goes down to a skeleton crew. Fewer safeguards are online. That's precisely why the stretch between midnight and sunrise carries the highest risk of heart attack and stroke for people over 60. Not rush hour, not the stress of the afternoon, the quiet hours when nobody's watching, but your habits still are. And here's the detail that changes everything. What happens to you during those risky hours is shaped almost entirely by what you did earlier that evening, what you ate, whether you took your medication and when, how warm or cool your bedroom was, choices that felt completely unremarkable in the moment. Let's start with the first one, the habit that surprises my patients more than any other. I ask nearly every patient the same question. What time did you eat last night and what was on your plate? Time and again, people over 60 tell me they sat down for a full dinner at 8, 9, sometimes even 10 at night. Pasta, a large portion of meat, maybe something fried, and then went almost straight from the couch to bed. I understand exactly why this happens. Long days, family schedules, habits built up over decades. But from a cardiac standpoint, this routine is quietly working against you. A heavy, late meal is one of the most underrated stressors your heart can face. Digesting a big dinner requires a major surge in blood flow to your gut. Your heart has to work harder to supply it. Blood pressure climbs, and the fat circulating in your bloodstream spikes sharply for 2 to 4 hours after you eat. Now stack that on top of trying to fall asleep. Your body expects the evening to be a wind-down period, not a full-scale cardiovascular workload. Instead, your heart ends up doing 2 jobs at once, digesting a heavy meal and trying to power down for the night. Those 2 demands pull against each other. For someone over 60 whose arteries have already lost some flexibility, that tug-of-war can have real consequences. Research consistently links eating within 2 to 3 hours of bedtime to higher nighttime blood pressure, more acid reflux, which can mimic or even provoke cardiac symptoms, and a greater chance of cardiovascular trouble during sleep. The fix is simple. Aim to finish your main meal by 6 or 7 in the evening. If you must eat later, keep it light. Lean protein and vegetables instead of anything heavy or fried. Does that sound like your dinner routine? You'd be amazed how many people say yes without ever connecting it to their heart. Pay close attention to this next one because it's where I see some of the most preventable harm occur. If you're over 60 and take blood pressure medication, and statistically, well over half of people in this age group do IOS. The timing of that dose matters far more than most people realize, and more than most doctors take the time to explain. Under normal circumstances, blood pressure follows a daily rhythm. It climbs in the morning, peaks in the afternoon, and eases at night. But a significant number of people over 60, especially those with hypertension, never get that nighttime dip. Their pressure stays elevated, or it actually surges in the early morning hours. This is called nocturnal hypertension. Most people have never even heard the term, yet it's more dangerous than ordinary daytime high blood pressure because your arteries simply aren't built to absorb a sudden pressure spike while you're asleep. A surge at 3 a.m. behaves very differently in your arteries than the same spike at 3 p.m. It's more likely to rupture a fragile plaque inside a coronary artery, more likely to trigger a clot, more likely to be the reason someone ends up on my operating table. If you take your blood pressure medication only in the morning, its protection may have worn off exactly when you need it most. If you forget it altogether, you may be completely unguarded during the riskiest hours of the night. So here's what to do. Talk to your doctor specifically about medication timing. Ask whether shifting your dose to the evening might be right for you. That conversation takes 2 minutes and could genuinely extend your life. Several major studies, including well-known chronotherapy research, suggest that taking blood pressure medication in the evening can meaningfully lower cardiovascular risk overnight. This isn't a minor tweak. It's a conversation worth having soon. Think about someone in your life who snores. Maybe it's a spouse, a parent, or maybe it's you. Most people treat that loud, irregular nighttime sound as a nuisance, something for jokes, something worth an elbow in the ribs. I treat it as a red flag for heart disease until proven otherwise. After more than 20 years in this field, I mean that literally. Sleep apnea is one of the most under-recognized conditions I encounter in patients over 60. Roughly a third of older adults have some form of it, yet the overwhelming majority are never diagnosed or treated. They have no idea what it's doing to their heart, night after night. Here's what actually happens during an episode. Breathing stops for anywhere from 10 seconds to over a minute, sometimes dozens of times an hour. Each pause causes blood oxygen to plunge. The brain senses an emergency and floods the body with stress hormones, adrenaline, cortisol, heart rate spikes, blood pressure surges. The heart is essentially jolted awake while the rest of the body stays asleep. Repeated night after night, year after year. Multiply that by 30, 40, even 50 episodes in a single night, and the toll on your cardiovascular system is anything but minor. Sleep apnea roughly triples the risk of heart attack. It's strongly tied to irregular heart rhythms like atrial fibrillation, which raises stroke risk considerably, and it accelerates the stiffening of arterial walls over time. Because all of this unfolds while you're unconscious, most people don't realize anything is wrong until a serious event forces the issue. The warning signs go beyond snoring. Watch for morning headaches, waking up exhausted despite a full night's sleep, frequent nighttime bathroom trips, a dry mouth on waking, or waking with a gasping or choking sensation. If any of that sounds familiar, ask your doctor about a sleep study. My advice to patients is direct. If you snore heavily, you're over 60, and you have any history of heart disease or stroke, getting evaluated for sleep apnea isn't optional. It's a core part of protecting your heart. Treatment. Most often a CPAP device isn't glamorous, but the evidence behind it is compelling. Patients who use it consistently see measurable drops in blood pressure, fewer episodes of atrial fibrillation, and a meaningful reduction in overall cardiac risk. One habit, enormous protection. Does anyone in your household snore? Has anyone ever told you that you stop breathing in your sleep? Sit with that question for a moment before moving on. Let's talk about a habit driven by perfectly reasonable logic, which is exactly why it's so easy to overlook. Many people over 60 deliberately cut back on evening fluids to avoid waking at 2 a.m. for the bathroom. It makes sense. Interrupted sleep is frustrating, and getting up in the dark raises the risk of a fall. So people stop drinking after dinner, sometimes as early as mid-afternoon. I understand the reasoning completely. But from a cardiovascular standpoint, going to bed even mildly dehydrated is a bigger risk than most people realize, and it's rarely discussed. When you're dehydrated, your blood thickens. It moves less easily through your vessels. For a younger, more flexible cardiovascular system, that's usually a minor inconvenience. But for someone over 60 with stiffer arteries and existing plaque, it's a very different story. Thicker blood moves more sluggishly through arteries that are already narrowed, and it's more prone to forming dangerous clots. Now add the timing problem almost nobody considers. During sleep, your heart rate and circulation both naturally slow down. Combine that slower circulation with thicker blood in a body that stays still for 7 or 8 hours, moving through arteries that may already be partially blocked. That combination is one reason heart attacks and strokes cluster so heavily in the early morning hours. The fix, fortunately, is simple. Drink 1 full glass of water, about 8 ounces before bed. Keep a second glass on your nightstand. If you wake up thirsty at 2 a.m., your body is asking for something your heart needs too. You don't have to trade a good night's sleep for a protected heart. You can have both. Here's a habit that surprises nearly everyone I mention it to because it sounds almost too simple to matter. What temperature is your bedroom at night? Most people have never thought about that question in terms of heart health, only comfort. But your cardiovascular system actually has a temperature range where it performs best. Outside that range, your heart quietly works harder than it needs to. If the room runs too warm, above roughly 72 degrees Fahrenheit, 22 degrees Celsius, your body works all night to shed excess heat. Blood vessels dilate, heart rate stays elevated, and you sweat more, which feeds right back into the dehydration problem we just covered. Sleep quality also drops, meaning you spend less time in the deep restorative stages where your heart does its most important overnight repair. Go too far the other way, below roughly 62-63 degrees Fahrenheit, 16-17 degrees Celsius, and you get the opposite problem. Cold triggers vessel constriction to preserve core body heat. As vessels tighten, blood pressure rises, and the heart has to pump against greater resistance. For someone already managing coronary artery disease or hypertension, that added nighttime pressure is far from trivial. The sweet spot for both sleep quality and cardiovascular protection sits between about 65 degrees Fahrenheit and 72 degrees Fahrenheit, 18-22 degrees Celsius. In that range, your body stays thermally comfortable, your vessels stay relaxed, your heart rate stays low and steady, and your sleep stays deep. One thermostat adjustment, real protection. Everything you've just heard might sound like a long list to worry about. I'd rather you see it differently, as a simple blueprint you can follow every single evening without overhauling your life. Eat your main meal. Lean protein, vegetables, a moderate portion of carbohydrates if you want them. Not a feast, not a skipped meal. Just something balanced, eaten at a reasonable hour, giving your heart 3 to 4 hours to finish digesting before sleep. Handle water and medication. If you haven't already discussed blood pressure medication timing with your doctor, let this be your reminder. For many people, an evening dose offers meaningfully better protection. Wind down, a gentle walk, a book, quiet conversation. Step away from bright screens, especially phones. They suppress melatonin and keep your nervous system more alert than it should be this close to bedtime. Prepare your bedroom. Adjust the thermostat. Crack a window briefly if needed. Set a glass of water on your nightstand. All of this takes under 2 minutes, but it matters. Be in bed. And one last adjustment that costs nothing. If you snore or someone has ever told you that you stop breathing at night, try sleeping on your side instead of your back. Back sleeping can significantly worsen airway obstruction while you arrange a proper evaluation. Dinner by 7, water and medication around the same time, a calm wind down until 9, bedroom set by 9, lights out by 10, side sleeping if you snore. The evidence behind this routine isn't in question. The only real question is whether you'll actually follow it. And that's something only you can decide. I want to speak to you plainly for a moment, not as someone making a video, but as a surgeon. I've stood at an operating table at 3 in the morning, holding a heart that stopped because a clot formed overnight inside a narrowed artery. I've sat with families in waiting rooms at dawn who had no idea anything was wrong when they said goodnight just hours before. I've reviewed case notes on people who, a week earlier, were planning a grandchild's birthday party. And in case after case, the contributing factors were never mysterious. A late dinner, a missed dose, a bedroom kept too warm, a body that had quietly gone dry, an airway that had been silently struggling for years while everyone assumed the snoring was harmless. These aren't rare or exotic risks. They're the background noise of millions of ordinary evenings. But that noise, repeated night after night, year after year, can eventually become the heart attack nobody saw coming, simply because nobody knew where to look. If more than 20 years in operating rooms has taught me one thing, it's this. Most of the hearts I've had to repair didn't fail because of bad luck. They failed because of missing information. Information the patient never had a chance to hear. Now you have it. The only question left is what you do with it, starting tonight, not next week, not after your next appointment. 1. Finish dinner by 6-7 p.m. No extreme diet required. Just a sensible meal at a sensible hour. 2. Ask your doctor about medication timing, specifically whether an evening dose of your blood pressure medication makes sense for you. 3. Get checked for sleep apnea if you snore, wake up exhausted, or have ever been told you stop breathing at night. Past 60. This isn't optional. 4. Drink a glass of water before bed and keep a second on your nightstand. 5. Keep your bedroom between 65 degrees Fahrenheit and 72 degrees Fahrenheit, 18-22 degrees Celsius. Free, simple, and protective. Which of these 5 sound like your own routine? If it's 2 or 3 of them, you're not alone. Most of my patients see themselves somewhere on this list. The difference now is that you know what to do about it. If this was useful, pass it along. There's almost certainly someone in your life, over 60 does, a spouse, a sibling, a close friend, who has never connected their nightly habits to their heart. Share it with them. Take care of your heart. It has worked for you every minute of every day, without complaint, for your entire life. Give it the conditions it needs to keep going for many more years to come. A final note. Everything shared here reflects general medical knowledge and clinical experience, not personalized medical advice. Before changing any medication schedule, especially the timing of blood pressure medication, please consult your own physician. That's not just a formality, it's a sincere request from Dr. William Lee, who genuinely hopes you'll be around to watch many more of these. Good night, sleep well, and starting tonight, take care of your heart.